Hi everyone, thank you for attending today's meeting. It is Puppy Raiser First Aid and Medical Basics, and we have our special guest presenter with me today, my husband, Daniel Talamantes.
Hello.
Puppy Raiser First Aid and Medical Basics with guest presenter, Daniel Talamantes, Certified Veterinary Technician. Please remember that this meeting is pre-recorded. All of the regional managers will be monitoring the comments and questions. And at the very end, we will have a live Q&A session, but it will be audio only. Okay, so first we're going to go over some reminders of general medical protocols for Southeastern Guide Dog puppies. All puppy vaccinations and appointments are pre-approved. You will want to refer to your medical records that you receive when you pick your puppy up from the Puppy Academy. And then pre-authorization is required for all vet visits that are not on medical record. Your first line of contact is going to be your area coordinator, and this is regardless of which veterinary hospital you use. If you use the Southeastern Guide Dogs Hospital or you use an outside hospital, either way, you want to speak with your area coordinator. They also have the Puppy Raising Services after hours number access in which they can reach a staff member to get further approval. This pre-authorization includes but not limited to concerns about skin, ears, eyes, limping, vomiting, and diarrhea. So these are things that are, we may want to have your puppy, for example, be crate rested for a little bit before moving on to a vet if they're limping. We do have a diarrhea protocol that we all know about that we want to follow before we rush off to the veterinarian, etc. If something is life-threatening, you must contact your AC for pre-authorization. So even if you are on your way to the vet hospital, you need to start having somebody from your family start to contact the area coordinator if you are unable to do so, or as soon as you get to the emergency clinic, you will need to contact your area coordinator.
Emergencies include any type of trauma injury, breathing problems, and I want to touch base on that. Just be mindful of what's normal and abnormal on that. Any bleeding, broken bones, ingestion of foreign body or toxins, and we'll touch a little bit on that later. Bites with fast swelling, such as bee stings, snake bites. Any vomiting or diarrhea that will not stop and is causing dehydration. Very bloody stool. Also look for any blood in the vomit as well. Any white, blue, or purple gums, check on that. You can do that by lifting the lip of your puppy and just to look at that. Temperatures over 103 is abnormal as well, so keep an eye on that. So learning to recognize first signs of illness. So the first sign is a huge one for Labradors, loss of appetite. That's a huge one. Any listlessness, lethargy, any vomiting or diarrhea again. I know on the previous slide, we talked about 103 could be abnormal, which it is. A normal temperature for a dog is 100.5 to 102.5 degrees Fahrenheit. Anything above that, look out for that. So contact your area coordinator at first signs of illness so they can give initial advice. If your puppy is showing severe or combination of above signs, contact your AC immediately. And then review any common ailments, which is page 115 on your PR manual.
So we have several topics that we're going to cover today with all of our first aid basics. The first is building an at-home first aid kit, then taking your puppy's temperature, how to construct a makeshift muzzle for emergencies, body handling for vet appointments, heat stroke, ingestion of foreign objects, toxic plants, toads, and food, lacerations, cuts, wounds, and limping. The first thing that we're going to talk about today is building an at-home first aid kit. The first thing you want to include in that kit is your paperwork. This includes any information about your vaccines, including the dates that they were completed, the contact information for the Southeastern Guide Dog Veterinary Hospital, your vet's info, and then the nearest emergency vet address and phone number. As a side note, you do want to probably drive to your nearest emergency vet just so that you are aware of its location and how long it takes to get to before you need it for an emergency. The next thing is gauze, nonstick bandages, and adhesive tape, and that's what that picture is right there, is some of that gauze, or rather nonstick bandages, and then antibiotic spray or ointment, styptic powder. Styptic powder is going to be used especially for whenever you quick a puppy's nail and it starts bleeding, helps stop that bleeding. Vaseline, rubbing alcohol, eyedropper or syringe. That's always good to have in case you have to give anything orally. Extra leash and collar. Again, if it's an emergency and you're just, if you're in the middle of panicking about getting everything together, you have that extra leash and collar. And also a soft muzzle. We are going to talk about how to make a muzzle out of gauze later in this presentation. However, you could have just a soft muzzle as well, and you will want to acclimate your dog to the muzzle ahead of time and not wait until you need it for an emergency. Again, we're going to talk about that in a little bit here, but you might need that muzzle if, for example, your dog is in a lot of pain and is lashing out in pain. So continuing with our at-home first aid kit, the next thing you're going to need is small scissors, tweezers, a digital thermometer. We will be discussing how to take your puppy's temperature. However, please make sure that your thermometer is clearly labeled that it is the dog thermometer and stays within your dog's first aid kit. A magnifying glass, disposable gloves, a flashlight just in case you need to look at something closer and, in their mouth or that sort of thing. Treats, a little tiny bag of treats just in case you need somebody to help you get the dog to cooperate while you look at something. And then Benadryl and hydrogen peroxide. However, you want to contact your AC or your veterinarian for guidance before using those. With the one caveat that the Benadryl, you can give the first dose immediately if you as soon as you start to see swelling or you think your dog has gotten into something that they're allergic to or a bee sting, something like that, you can give that first dose immediately. But after that, you need to contact your AC and or your vet for further dosage instructions. There on the screen, you see it's 25 milligrams per 25 pounds. Hydrogen peroxide is in there for inducing vomiting if your dog eats something that they're not supposed to. However, we will talk about this later, but you definitely need to wait until a veterinarian tells you to give the hydrogen peroxide and to induce the vomiting, because there are some items that we would not want the dog to vomit.
All right, so we just talked about building your at-home first aid kit. We're just going to show you some of most of the items that we talked about in there. First of all, we talked about your paperwork. I'm not going to show you that necessarily. Gauze, nonstick bandages, and adhesive tape. We have all types here, right there. We're going to put them down here in our little bag. This is vet wrap. A lot of this stuff you guys can get at the Dollar Tree. And you can also get a lot of it at places like Target or CVS. And then next we have antibiotic spray or ointment, styptic powder, which I actually don't have right at the moment, Vaseline, rubbing alcohol. We're not going to put this in our bag, but that's our rubbing alcohol. An eyedropper or syringe. Again, this is great for if you have to give anything orally, especially if you have to give your dog hydrogen peroxide to induce vomiting. Extra leash and collar. So you can take any leash and actually make it both leash and collar in an emergency by looping the one end through the handle. And then this can be like the collar, and you can just slip it over the dog's head and quickly walk the dog to the car or restrain the dog as needed. Soft muzzle, we're going to actually show you how to make an at-home muzzle in a second. Small scissors, tweezers. You can actually get most of that stuff if you get a little cuticle or nail file kit. Manicure kit, I guess is what it's called. So this has the scissors in it, and it has tweezers right here as well. It does have a pair of nail clippers in there as well, and even a nail file. So if your dog is not tolerating nail clipping, but you need to file the nail down because it broke or something like that, you even have that. So you can get a little manicure kit to have all that stuff. Digital thermometer. Remember, you want to mark dog all over it so that you make sure you don't mix it up with the one that you use for the humans. A magnifying glass. This one's kind of big, but we got a magnifying glass in case you need to look at something close, especially if you live in an area with ticks, that sort of thing. Disposable gloves. So we have a bag of several disposable gloves here. A little flashlight. Again, you can get most of the stuff at the Dollar Tree, really cheap, and make your whole thing, your whole kit there. A little bag of treats. Again, you want those in case you have to, somebody has to help restrain the dog and we have to lure the dog, emergency lure, something like that. This is really helpful to have a little bag of treats ready to go, not look for them at the last second. And then we have our Benadryl and our hydrogen peroxide. All right, so that's our whole at-home first aid kit.
So taking your puppy's temperature. So the supplies you need are a rectal digital thermometer, Vaseline or any other type of lubrication will work, preferably 2 people. One person restrains the dog, the other person takes the temperature. You're going to put lubrication on your thermometer and wait till it says ready. You're going to lift the tail, gently insert the thermometer into the rectum. Only insert the small, thin section of the thermometer, not all the way in. Make sure the thermometer goes straight into the rectum. Hold in place until the thermometer indicates reading has been received. If the dog is not tolerating the temperature taking, you can do an axillary region, the armpit. Remember, normal range is 100.5 to 102.5 degrees Fahrenheit. Okay, now we're going to show you how to insert the thermometer into the rectum properly. But first we're going to show you how to do the armpit, just in case your dog is not being cooperative about it. So first you're going to need 2 people, preferably. One to hold and carry. My wife is going to hold Evie. First, so if she's not cooperating with me, so what you're going to do is just use this part right here. And I'm just going to go underneath her armpit, and I'm just going to press and hold, and just hold it nice and tight, so that way, you know, you can get almost an accurate reading. So you take your thermometer and use any lubrication that you have. We have Vaseline. Insert what you need, and remember, you're only going to insert the thin part pretty much to this white. You can't probably see it on camera, but to me, to this white part right here. So you turn it on, wait till it says ready. Okay, you're going to lift the tail up and just gently insert the motor. Don't jam it in there, it does startle them. And just wait, and the timer's off. She's 102.0, and once again, a dog's temperature can be 100.5 degrees Fahrenheit to 102.5 degrees Fahrenheit, being normal. How to construct a makeshift muzzle. In an emergency, you might need to muzzle your pup because he's in pain or lashing out. You can use a gauze and a first aid kit if you do not have a muzzle handy, and we'll show you how to construct one in the following video. All right, we're going to make a makeshift muzzle. So grab some gauze, doesn't matter the length, but as long as it's long enough. You're going to do it into a loop, a loose loop here, just like that. And you're going to apply it over the muzzle. Thank you. And you're just going to gently squeeze. You don't want to squeeze too tight because, you know, constrict the airway in her nostrils. Then you're going to go in behind the ears, behind the neck. Make sure the ears are under. And then you're going to do tie a knot into the, you don't want it too tight, but as long as you can get 2 fingers, you could probably, I don't know if you can see that, but that's it.
Body handling for vet appointments. This is very similar to the presentation that Catherine and I did for the Puppy Raiser Conference recently. So if you would like a more comprehensive overview of body handling in general, I definitely suggest checking out that session. We have a bunch of videos with that session. So what qualifies as body handling? A lot of times people think petting and massage are the main two things, but it includes a lot of things here. Brushing their hair, brushing their teeth, cleaning ears, clipping their nails, restraining, vet exams, and other people doing all of the above. And specifically vet exams and restraint are what we're going to discuss a lot of today. So when we are talking about body handling for vet appointments, the goal here is to have the puppy comfortable and accepting of having all body parts touched and gently manipulated with minimal restraint needed. Additionally, with that being with strangers, because you'll have the vet techs and veterinarians that are doing that type of restraint and manipulation. As with all body handling, here are some tips for your sessions when you're working on this. First of all, you should definitely be calm and relaxed, both you and the puppy. Practicing in a quiet area with very few distractions, such as maybe your living room or a quiet bedroom, something like that. If needed, if you're going to use treats and you are sitting on the floor, for example, you might want to put your treat pouch on a high table nearby so that this does not distract the puppy from trying to reach for your treats around by your side. You should talk in quiet, soothing voice and tones when talking to the pup while doing the body handling. There is no need to mark with yes, because this can excite the puppy. And so we're just going to quietly offer treats to help form a positive association with body handling. Ways to build a positive association with any form of body handling, but including vet appointments. Your sessions initially are going to be focused on long, slow strokes across and down the pup's body, their back, neck, chest, and legs. So that's how you're going to start with, for example, when you first bring your brand new puppy home, just nice, long, slow strokes across their body. Once the puppy is comfortable with that, then you're going to move on to touching pup's ears, eyes, mouth, feet daily. You want to make sure this is a normal occurrence for them. This is nothing new for them. And you're going to achieve that by doing this pretty much every day. You're going to calmly give treats when the pup is not struggling. That's very important. You don't want to give treats when the pup is struggling because you don't want the pup to interpret that as a reward for struggling. You're going to gradually add in more body parts to your daily body handling sessions. So initially you might start with the long, slow strokes. Then after your pup is really comfortable with that over a period of time, you're going to add in touching their ears and eventually touching their eyes and moving on. When the puppy is comfortable with the razor handling, then you want to start adding in other people doing brief touches on your pup. So maybe you're going to do our vet hold that we talk about a lot and have somebody come up and just run their hand down the dog's back. Again, they're going to sort of start like you are, where they're going to start long, slow strokes down the pup's body, and then eventually when your puppy is comfortable with that, the person can come up and additionally touch the puppy's ears and then the puppy's eyes and move on from there.
Why is it important for your dog to allow others to handle him? Well, as a veterinary technician, it's a lot less stressful for me and for my doctor, but most importantly, less stress for your dog.
Additionally, by allowing others to handle your pup, our blind and visually impaired handlers and also our service dog handlers, they're going to want to be able to fully examine their dogs. So that also helps take the stress off the dog in that situation.
All right, so we're going to talk about how to build that vet hold on your dog. I know that we do this at our walk and talks. We often ask to see your dog in the vet hold for body handling. Some dogs are not completely comfortable with it, so we're going to quickly talk about how to build on this. Catherine and I also touched on this during our body handling session for Puppy Raiser Conference. Come here, let's go. And we do have our Chihuahua over here out right now. So if you might see his shadow in the gate there, or you might hear him. He wants to be over here with us. So initially you can just use treats. I have a treat patch on me right now. You can just use treats. And I'm gonna put my hand on her belly and then let go. Put my hand on her belly, give a treat, and let go. Right now she's standing a little far away from me, but if that's where your dog is comfortable, that's fine. You don't want to lean over your dog a lot. You don't want to like loom over them in the beginning. Right now she's looking for the treats. This is another reason why you want to sometimes keep your treats up high. But again, hand under the belly, treat, let go. There, Eve. Hand under the belly, treat, let go. Then we're going to move to hand across the chest. Evie, come here. Let me get her a little bit moved over here. There we go, good girl. So hand across the chest, treat, sorry, let go. I grabbed under her belly too. Hand across the, I'm going to move my treats under this side. So this will be a little easier from the angle that she's standing in. So right here, my hand across the chest, give a treat, and she hears the treat. This is a little tricky. Why don't we do this? We'll switch her around, and Daniel can reach for treats and give her treats for me. Come here. Come here. Right here. There we go. All right, so we're just getting her in place. She obviously is fine with her general vet hold here. She's just getting excited for those treats. So I'm gonna put my hand across her chest. Daniel, you can treat her if you'd like. And you can do this with your dog if you need to. She's getting very excited with that treat. All right, and let go. Of course, Eve is getting very excited for the treat. So we'll stop there. But I will just show you the importance of making sure your dog has this positioning pretty well. All right, so now we have Eve in our vet hold, and now our vet tech or doctor can come and examine her. So you can go ahead and look in our ears or something.
So always, play with their ears. So this is what the vet's gonna do. In their mouth, usually they like to open up, look inside, pause, make sure they're getting used to the pause, which I think
she's a little struggle
with that, so that you can see why it's important to mess with, with every parts of the body.
Yes, and so this is really important to, again, continue to build up with both you doing the body handling, but also other people doing the body handling, so that your dog does get used to that. Eve is definitely sensitive with her feet at times, so that's obviously an area we continue to work with. I am going to also put in Catherine's video that we did during the body handling session, because she had a great video of building that vet hold as well.
Oh, what a perfect girl.
See?
All right. Get some cookies. Good girl. Yes. Good girl. All right. Can you stay standing? Thank you very much. All right. Yes. Good girl. Yes. Good job. Yes. Good girl. Good girl. Yes. pressure. Yes. Good girl. Very good. Right. Is it? Very good. That was an awesome job. Thank you.
Watching for a heat stroke. Living in Florida, well, heat strokes are very common where I work at the emergency clinic. Dogs do not sweat like we do. They have more difficult time cooling off their bodies once they're overheated. You want to keep an eye out on the outside temperature, including the heat index. So make sure your pup is not excessively playing outside where they might overdo it. Make sure your pup has access to water and shade as they are playing outside. And please always supervise your pup outside. This means you want to stay outside with them. So here are some signs to watch for heat stroke. Excessive panting, unable or unwilling to move around, enlarged and reddened tongue, drooling, reddened gums, meaning like brick red, vomiting, diarrhea, mental dullness, loss of consciousness, uncoordinated movement, and collapse. So how to treat for a heat stroke. So remove the pup from heat and into a cooler location. Apply cool, not cold, water to the dog. Offer cool water for the dog to drink as well. If possible, apply a cool wet towel for a minute at a time, then replace it with another cool towel. Call your area coordinator as soon as possible. If possible, continue to take your dog's temperature every 5 minutes until it reaches below 103. Your area coordinator may recommend taking your dog to the vet if a heat stroke is fairly severe. All right, so our next thing that we're going to talk about is ingesting foreign objects. So your pup should not be allowed to chew on any items that are not their toys. But we know that our puppies can sometimes, find something they're not supposed to have. So if your puppy does ingest something they shouldn't, here are some pointers. You want to collect all information about the item, the size, the type, the amount, any wrappers, etc. You want to call your area coordinator immediately. For human medication or chemicals, if you get into that, you will want to call the ASPCA Poison Control Hotline. Just make sure you mention that you have a puppy from Southeastern Guide Dogs because they're a nonprofit and they will waive that fee. Otherwise, pay the fee and then you can submit for reimbursement. Just make sure you have fresh hydrogen peroxide on hand in case your area coordinator or the veterinarian tells you to use this. So do not assume you always are going to induce vomiting for ingestion of a foreign object / material. Some items are more dangerous if regurgitated, such as a glass, a needle, something that's very hard that can, mess up the esophagus. Only induce the vomiting if your area coordinator or your veterinarian tells you to do so. The measurement for hydrogen peroxide is 1 ml per pound. You do not want to exceed 45 mLs.
Now we're going to discuss toxic plants, toads, and food. So the first thing is you always want to look up the toxicity information before planting anything in your yard. You'd be surprised at some of the items that are toxic to your dogs. The SPCA has much of this information on their website, so you can always visit that website to look for this. Some of the common toxic plants that people plant: azaleas, daffodils, tulips, sago palm, oleander, mums, peonies, black walnut, irises, foxglove, cardboard palms. There are many others out there as well. It's often that the bulb is often the very poisonous part of many of these plants, such as I believe the daffodils and tulips. Be aware that some mulch has cocoa bean in it, which is poisonous to dogs. So be very careful about what type of mulch you are using. All right, we're going to talk about some common foods that are toxic to dogs. Of course, all of our puppies should never eat human food, but there are some foods that are actually toxic to dogs, and you do want to be very aware of what those type of foods are in case your dog does ingest one of these foods, especially large quantities. Human food that is toxic: chocolate, grapes, raisins, avocados, onions, garlic, alcohol, caffeine, macadamia nuts, peaches, and plums, specifically the pit, salt, baking powder, baking soda, yeast, nutmeg, and other spices. Xylitol is a chemical sweetener that's in certain types of gum, toothpaste, peanut butter. The peanut butter, it is usually a specialty or health store varieties. It's very rarely the type of peanut butter you're going to find in a regular grocery store. But you do want to check if you're going to use a little bit of peanut butter on a toy, you do want to check that it does not have xylitol in it. Also, that's in diet foods in general. Then obviously we have human medications, vitamins, etc. While there are some medications that dogs can be prescribed that humans are also prescribed, you definitely want to make sure that if your dog ingests any human medication, you go ahead and contact your AC and your veterinarian. And if your pup ingests large amounts of one of these items, you may need to call the ASPCA poison control hotline. And at that point, you're going to be calling them to make sure that what they have, you have time to possibly induce vomiting or something like that. But again, you're going to have to call that ASPCA poison control hotline. Okay, now we're going to talk about toads, specifically bufo toads, or otherwise known as the cane toad. They are becoming more and more prevalent in the state of Florida, and they are extremely toxic to dogs. You do want to notice that on the picture here, there are no ridges or knobs on the head, and there is that large gland that is angled downward over their shoulder. So that's how you're going to identify them. They tend to be very large, but obviously baby ones are maybe not going to be as large as adults. So you still want to make sure that you're checking any toads that your dog is around. So if a dog licks or bites one of these toads, it will receive a large dose of that toxin, which is absorbed rapidly through the gums and directly into the bloodstream. And that is why, because it's absorbed so rapidly, that is why it's very important to get your pup to an emergency hospital and call your AC and the ASPCA Animal Poison Control Hotline immediately. They are attracted to the smell of pet food, so you don't want to leave food bowls or bowls stored outside in general. That could even be a water bowl. If you have a water bowl outside, make sure that when you guys are done for the day that you turn that bowl over so that there are no toads that could sit in the bowl and release those toxins, making your animal sick. Additionally, if you have an outdoor cat, leaving their food in a bowl outside can actually attract those toads as well. If you are pretty sure that your dog might have licked or bitten one of these bufo toads, you'll see here at the bottom we give one way to help them out, and that is you have your dog lay on its side. So that new over command is really handy in that situation. You want to rapidly wash their mouth out. You do not want to push the water into the dog's throat and down their throat, because that is actually washing the toxin into the body. Instead, you want them to lay on their side, and then you're going to rinse their mouth out over the side.
Lacerations, cuts, wounds, and limping. Lacerations are one of the most common reasons for vet visits. I should know because we get plenty of those at the emergency clinic. So you always want to call your area coordinator if your pup has a laceration or is limping. If a wound is bleeding, be careful. If the pup is in pain, you may need to apply a muzzle because they might, just bite out of, just pain. Apply a clean towel with gentle pressure. If the wound appears to be very deep and or larger than 1 inch, an emergency vet visit is likely needed. If needed, apply a gauze and a non-stick bandage wrap. Make sure that it's not too tight. Check the toes every 15 to 20 minutes just to make sure there's no swelling to indicate that the bandage is too tight. For a pup who is limping, put the pup on immediate crate rest. Check for any cracked toenails or ripped pads. Continue to monitor the situation and keep your area coordinator informed. Your area coordinator will decide when a call to the vet is necessary.
We want to thank everyone for tuning in. Now we're going to switch over to our live version, which will be audio only, and we will be taking questions. Hello, everyone. This is Carrie and Daniel, and we are live now. We do have our dogs out, so you might hear tails wagging or bones, being chewed. We are going to answer a few questions. First of all, thank you for hanging in there with the technical difficulties. Facebook Live is not always the most intuitive thing, surprisingly. So we apologize if you were unable to find the new recording, but here we are now. Okay, also, I wanted to make a note about something that we did in the video that I just want to make sure that you guys take note of. If you dip your thermometer, your dog thermometer, directly into your jar of Vaseline, please make sure that you label that jar of Vaseline for dog only, and make sure you keep that within your first aid kit. All right, so we pulled a few questions that we saw while the presentation was going on. First one is this list of items for the first aid kit, is that in the puppy raiser manual? And that was from Diane. Yes, this is on page 27 of your puppy raiser manual. This was on our presentation here, it was for mostly geared towards emergency. So you will see that there are in the puppy raiser manual that the kit has a few items that we might consider for grooming, such as nail clippers. I think there was cotton balls you might use for cleaning out your ears, that sort of thing. All right. So Daniel's going to answer the question about whether or not famotidine, or otherwise known as Pepsid, it should be in the emergency kits, and that was from Diane.
So that would be no. That's, it's not a endangerment to the dog, but it should be given when instructed by the veterinarian, because it's it's the working ingredient in Pepsid AC. It's an antacid, so I would just wait to give that instructed by your vet. Yes.
Yeah, and so because it is for like an upset stomach, you should probably be talking to your vet first about why your dog's stomach is upset in that situation. Loretta had a question. Is there any difference in toxicity of different chocolates? I don't know if I quite copied that down correctly, but that's, I believe, what her question was. Do you want to answer it or me answer it? Okay, I'll answer it. So first of all, white chocolate, the main thing is that you're looking at the cocoa. That's the part that that's considered toxic to dogs. So something like white chocolate is not really going to have that present, most likely. Milk chocolate is also not going to be as dangerous. However, anything in large quantities especially is going to be dangerous, and you definitely want to call your area coordinator. Essentially, the darker the chocolate, the more toxic it is. But any chocolate that your dog does eat, you definitely want to call your area coordinator and talk to them about it, and whether or not we need to have you move on further to the poison control hotline or to your veterinarian. All right. John asked, he commented that his pup sometimes finds mushrooms in the yard. Is a small amount of mushrooms a concern? While there's a good chance that maybe if your dog ate a small amount of mushrooms, you may not see an effect, the problem is that there are many, many types of mushrooms out there, and even a little bit of some mushrooms can be very, very poisonous to your pup, very toxic, make them sick, cause different types of side effects, and maybe even possibly kill them if they're very, very toxic ones. Even if they're small, I would definitely, I know we walk around our yard and pick up mushrooms all the time and try to, anytime we start seeing mushrooms, start to try to address that area. Just because there are so many mushrooms, it's almost hard to sometimes even find what type of mushroom you're even looking at. All right, those are the ones I copied down. So we're going to start taking some questions about other things that we're trying to scroll through the comments here. So Richard is asking, if taking the temperature of your armpit Should you add anything for a more accurate temperature? You want to? Okay. Sorry, Daniel and I are going back and forth. Who's going to answer? I mean, if you're having to take the temperature via the armpit, it's because your dog is not tolerating the temperature through the bottom. The more accurate temperature is through the bottom. We did demonstrate the armpit just in case you have a puppy who is really struggling and is not allowing you to take their temperature through their bottom. So that would be a secondary temperature, the armpit. That would be like if you really cannot do one the traditional way, the more accurate way. Can we use a small amount of canned pumpkin to help with upset stomach? It kind of asked by both Nancy and Charlene. You definitely always need to talk to your ACs and follow our diarrhea protocol. So that's always going to be, that we're going to follow our diarrhea protocol so that everything is really consistent. I know people for their pet dogs might give pumpkin or might do chicken and rice, boiled chicken and rice. But for our puppies on program, we do need to follow our diarrhea protocol and our recommendations from our veterinarians. If a veterinarian through Southeastern prescribes the pumpkin for you, then that is fine. But again, you would need to talk to Dr. Conrad or whoever your vet is with Southeastern. What part of the palm tree is toxic? So it's not all palm trees that are toxic. It's certain palm trees. The biggest one that's toxic is the sago palm. That's the one that most people know about. That one does grow kind of low, so it's a lot easier for dogs to reach. And I believe that I'm not really sure if it's like a fruit or a nut. I'm not really sure what it would be considered. The seed is kind of a red color. That specific part is extremely toxic to dogs. Again, if you have any sort of palms or any plants in your yard that your dog can access, you can always go visit the SPCA website, and they do have a whole page dedicated to all different types of plants, telling you how toxic they are, what might happen if your dog were to eat certain parts of them, and they will even tell you, what parts are toxic. So, for example, with like daffodils and tulips, it's not necessarily the flowers or leaves, but it's more the bulb that's in the ground. But it will tell you on the SPCA website that type of information. Can you talk about hot spots? We had a few in our group who had them this summer. Do you want to talk about that? Hot spots?
Hot spots?
What they are?
Like skin?
Yeah,
allergies?
The skin, yeah. Mm-hmm.
Yeah, I could address that, I guess. Hot spots, it's probably related to allergy. Could be related to flea bite allergy. So just make sure your babies are on flea control. All your babies in the house if you have other pets. But yeah, it's normally like an allergy, flea bite allergy. Just keep an eye out for it. Usually you can tell with, they're losing patches of fur towards the rear there. But it's mainly allergies, and I've seen it quite a lot in, in the clinic, obviously. So I wouldn't apply anything to that area. If you do see it, obviously contact your area coordinator to go from there.
Yeah, so, Labs and Goldens have the type of hair that's just going to really keep that moisture in. And we live in Florida. It's just very humid. If your dog goes swimming a lot, there's a chance that they could sort of keep that moisture in under their fur. That's a lot of times how those hot spots sort of manifest. It is best to talk to your area coordinator as soon as you start to see any sort of sign of what you think might be a hot spot, so that we can address it from there. We're not going to give specific directions on how to address hot spots, just because each hot spot might be different and how you treat it, which is why you just need to really contact that area coordinator, and we will go from there. Either they will contact the vets or your RM, and we'll start going from there.
Can I address something real quick?
Yeah, go ahead.
If you don't mind.
Go ahead.
Back to the flea bite allergy, Some dogs have it, some don't. So you might think, well, my dogs are not going to have because they have, flea control on, which is true. But however, it takes just one flea to jump onto the dog to take a bite, and that's how it's killed. And they might have a reaction, just like how somebody might have a different reaction with an ant bite. I might not have it, but Carrie might. So everyone's different, and even it includes animals.
Yeah. So, sorry, sorry if anybody's hearing anything. One of our dogs is bumping the table that we're using. So I believe that Colleen asked a question generally about how to handle paw pad cuts. It depends. So the first thing is that be really aware that if you have a pool at home and your puppy swims a lot and then starts running around, like especially if you have like another dog with, you guys are doing a pool play date or something, they might run around the cement a lot with those pads that are nice and soft from the water, from being swimming. And that might cause some kind of peeling or cutting of the paw pads. And so you just need to be really aware, be really careful when you guys are having them out running and playing around their pool, especially if there's cement. But it does happen sometimes. I would crate rest your dog for the most part. Would you wrap?
I wouldn't wrap it. Yeah, I would let the air.
Yeah, most of the time, unless it's like a deep cut, in that case, that's probably an emergency that you need to call your area coordinator about, and you probably need to go to your veterinarian. But sometimes you'll see that the black part of the paw pad kind of peels back a little, and it kind of dries out at that point. So I would probably crate rest your dog because their feet are going to be sensitive. All right. Let's see. I've heard that when a pup has diarrhea or an upset stomach, skipping a meal and giving them some. So just remember, guys, follow our diarrhea protocol. Usually that is some sort of skipping of meal. So just make sure you are following that. That is on our Puppy Raiser resources page, and I believe it's also in our manual. But definitely on our Puppy Raiser resources page is where you're going to find the most accurate information. Is a dog's temperature accurate with a digital thermometer? I was thinking, no, that's from Trish Gorey.
We
yes.
have a digital.
Right, we have a digital.
Yeah.
You have a digital. You guys use digital at the hospital.
Mm-hmm.
Yep. So Daniel's emergency hospital and his other hospital he works at, both use their digital. They are pretty accurate. Let's see here. Trying to look for questions. More questions. How often should hydrogen peroxide be replaced? I would guess I don't exactly know. Daniel's saying he doesn't know either exactly, but
it would be. I would go with the expiration date on the bottle.
Yeah, there should be an expiration date on the bottle, and make sure that hydrogen peroxide is in a dark bottle for a reason. Do not pour some into a clear container and have that out. It's not really supposed to be, getting a lot of light that affects it. So there should be an expiration date on your peroxide, and at that point you can look at that. My pup was stung by a wasp once, and my AC talked me through a situation, but what are some things to consider with a situation like this? That's from Edward. If your pup is stung and you see that, you can give that first dose of Benadryl that we recommended in the presentation, which is 25 milligrams per 25 pounds. Most Benadryl comes in 25 milligram pills. So you can give that first dose and then start to call your AC right away and let them know, update them throughout the day as to how your dog reacts. If they get stung, some dogs may have little to no reaction, but some dogs, their whole face might swell up, and then the worry is that their airways would swell up, which is why you want to go ahead and give them that Benadryl to try to help with that. All right. I think we have, let's see here. We have a magnolia tree that sheds its blooms. Should we be concerned if they grab one from Laurel? I'm not really sure if magnolias are toxic. I don't think they were in
I haven't heard it.
I don't
It's
think they were
usually
in
on
our
their
list,
website.
but you can go on that SPCA website. Really encourage that. They have so many plants on there with so much information. It should be pretty easy to find. You can just search SPCA plants, toxic plants, something like that, and it should come up right away. It's really easy to find. So, all right. I think that's it for questions. We will go through and answer any other questions in the comments that we might have missed. But I'm not seeing any other further ones on the comments, nor am I seeing them from my coworkers who have been so nice to text me questions that we might have missed. All right. Thank you so much, and everybody have a good Labor Day. Happy, safe Labor Day. Thanks.